If every pharmacist makes clinical decisions, why does the title clinical pharmacist still matter? Yes, many of us are PharmDs by education and qualify as clinical professionals. But I have seen pharmacists take to social media and argue that the title clinical pharmacist is redundant because we all practice pharmacy and make clinical judgments every day. However, I would like to add a few things. Speaking as a pharmacist who works in a hospital setting, every hospital is different and each hospital has its own organizational structure, with pharmacists serving in many different roles. But I want to add something meaningful to the conversation about the title clinical. Again, I can only speak as a hospital pharmacist. If you work at a local Walgreens or at any other major chains, feel free to enlighten me in the comments below. I encourage your input. But if you analyze the shift of a pharmacist working in a hospital, we will make clinical decisions or recommendations about patients' medication regimens hundreds of times a day using real time clinical data, more often than not, only having seconds to make those decisions accurately. Then we have to consider the different units within the hospital because there are levels of clinical judgment. Wouldn't you agree? We would spend more time evaluating a decompensating patient in the ICU than someone going home with amoxicillin capsules after an emergency department visit, right? What about intravenous solutions that are not simply normal saline or D5? This area of pharmacy is also a different animal. Intravenous administration bypasses first pass metabolism and can produce more immediate effects. Many IV medications also require close laboratory and clinical monitoring. How often can a big chain pharmacist say that they're concerned about the osmolality of an IV solution or the compatibility of a medication with another IV medication or solution? So I would disagree that the title clinical is redundant. Speaking as a hospital inpatient clinical pharmacist, the frequency at which clinical decisions must be made using real-time data within extremely short periods of time and across patients with varying levels of care throughout the hospital makes it evident to me that the title clinical pharmacist is appropriate.